Welcome to the Studio Chat podcast. My name is Barbara Thompson. Each week I'll be bringing you a self-care expert or a message to help you to discover how to live your best life and understand your mind-body connection. Thanks for spending some time with me today. Now, let the Studio Chat begin. In today's episode of Studio Chat, I'm so excited to be bringing to you Dr Emily Parke. We talk anything and everything about functional medicine. Upon graduating from med school, Dr Emily completed her anesthesiology residence at the world-renowned Cleveland Clinic, which is consistently ranked one of the top 3 hospitals in the world, where she served as chief resident from 2006 to 2008. Seeking to further her training, Dr. Emily then pursued a fellowship at the Children's Hospital of Philadelphia, which is consistently ranked one of the top 3 hospitals in the US, where she was named Chief Fellow. At the conclusion of her training, she moved to Arizona, where she practiced as a pediatric and pediatric cardiac anesthesiologist, undertaking complex and high-risk cases. In addition to this work, she served as the Vice Chair of the Pediatric Pain Medicine Department at Phoenix Children's Hospital from 2010 to 2012. A born achiever who dedicates 100% to the task at hand, Dr. Emily was fully committed to her role as an anesthesiologist. However, as the demands of her position took a toll on her well-being, she became unsatisfied with what she perceived to be an over-reliance by the medical community on band-aid solutions, like pills and procedures, rather than actually seeking to treat the underlying cause of a patient's health concerns. On the recommendation of a friend, she first turned to acupuncture for her own care and was really impressed with the benefits that she experienced from this. Upon discovering the curative possibilities of acupuncture, Dr. Emily was convinced that she could use it to help her patients and completed her training in medical acupuncture. The premier physician acupuncture training program in the US was through the Helms Institute. During her training, she met physicians practicing integrative and functional medicine alongside acupuncture, which then sparked her own pursuit to learn all about functional medicine, and this led to her training with the Institute for Functional Medicine, which is associated with the Cleveland Clinic, and became a certified practitioner. In 2015, she opened Arizona Wellness Medicine, where she is the founder and owner of this practice. I'm bringing this podcast to you today because I truly believe functional medicine has a place in the world, and especially today. Functional medicine addresses the whole person instead of just a set of symptoms by shifting the focus from disease-centric treatment to a multi-dimensional understanding of how the full spectrum of a person's life impacts their overall wellness. I really, truly believe there's a need for functional medicine. There's been so many increases in chronic disease demonstrated that our society is dealing with a health crisis. Traditional medicine emphasizes acute treatment for issues that have already risen, whereas functional medicine emphasizes finding and treating the cause of symptoms and disease using science-based strategies to do with nutrition, exercise and movement, sleep, advanced lab testing, stress management, and toxin reduction. Through this full spectrum approach to each person's total well-being, functional medicine offers a comprehensive solution to not only ease chronic conditions, but to actually prevent them entirely. Get nice and comfy, get all rugged up if it's winter where you are at the moment, and I truly believe this episode is going to change your life. Let's dive in to this podcast with Dr. Emily Parke, all about functional medicine. Hi guys, welcome to this episode of Studio Chat. I have a very special guest with me in Arizona, Dr. Emily Parke. Welcome to Studio Chat.
Thank you, Barbara. Thanks for having me.
Oh, it's such an honor to have you here, and I'm really excited. Can you share a little bit with my listeners about who you are and what you do?
Sure. So I practice something called functional medicine, which is a type of integrative medicine that's all about finding and treating the root causes of whatever signs and symptoms are going on. So root causes meaning why is what's going on in your body happening? Or what are the multiple reasons, which a lot of times there's more than one, for why you're feeling the way you are, or even having a diagnosis, even getting something like, for example, type 2 diabetes or high cholesterol or high blood pressure or depression and so on and so forth. We really dig into why is it going on versus in traditional medicine. We were, and I, by the way, I was, fully trained in traditional medicine to start with. I was actually a practicing anesthesiologist before getting on my own journey and becoming a functional medicine provider. So I come from the traditional medicine background, and unfortunately, they really just teach us when someone comes in, they have this certain symptom or diagnosis, here's the protocol, here's the medication or the procedure to treat it. So, you could have, let's say, 10 people coming in with one diagnosis, like, for example, high blood pressure. And there could be a handful of different reasons why that person is having high blood pressure. Instead of, oh, I see the blood pressure is high, let me prescribe you this beta blocker medication to lower it. There's no thought behind why did it happen to begin with? Like, is this person super stressed? Do they have anxiety? Are they not sleeping well? Is there, some kidney disease going on in the background? What's going on dietary wise? Are they not exercising? And so on and so forth, right? Like getting to the multiple reasons why it could be going on. Because even if you take medication for something, you're not, it's a Band-Aid. You can lower the blood pressure, but the reasons why it started are still there in the background. And so that's true for pretty much every diagnosis and every sign and symptom that we look at in functional medicine.
For sure, because you would think, wouldn't you, like if it was me, if I had a disease or a symptom, I personally would like to know to get to the bottom of it. But what I heard from your shift from going to traditional to functional medicine was that it wasn't treating the patient and it wasn't treating the cause.
Yeah, exactly. And so functional medicine is like different from traditional medicine in many different ways. So that I described kind of like the thought process, but some of the other things that make it a little bit different are we spend a lot more time with our patient. We review the health history literally from the time the person was born all the way up until the time they're sitting in front of you. So there are a lot of, at least in my practice, there's a lot of forms, that I have patients fill out because I want to know a lot about you even before we meet. So I can start thinking about like what questions I want to ask you and what, I may have it may lead me to ask you things that you may not have even thought about for your own health that may be impactful. And so we spend a lot of time with patients. A new patient visit is like 90 minutes. And which is that. And like I said, that's after I've sat and looked at all of your records and everything. So I know, everything about you. I even have notes on you before we even meet for 90 minutes. Really want to get to know you. So I like to say it's also a team sport, right? So it's not just like it's a relationship. It's a very relationship-based type of medicine because this is not, take this medicine because I told you to. It's, okay, let's together figure out why things are going on for you. Why are symptoms going on? Why do you have these diagnoses? Why were you prescribed these medications by other doctors? Why is it going on? And then what kind of testing do we want to do to find out those whys? And that's another thing that makes functional medicine a little bit different is we look at all kinds of testing that your normal, regular, primary care doctor wouldn't even think to look at. So we do order regular blood work like them, but we also order a lot more. And even just a regular blood work panel, I'm looking for a lot more things. We have all this other advanced testing. We look at stool studies for, gut health and, breath tests to see if there's, SIBO or EMO going on. We look at organic acids tests. We look at environmental toxins, heavy metals, food sensitivities, food allergies, and so on and so forth. So we have a whole huge toolbox of testing that we can, that helps us identify what your specific root causes are.
Wow, I can see. Yeah. Oh my gosh. So you've explained what functional medicine is because I know here in Australia, and most of my listeners are from Australia and New Zealand, it's not, I don't think it's a well-known topic. And that's why I'm so honored to have you here today. And I would love to know your how and your why you moved from traditional medicine to functional medicine.
Yeah. So I had my own story. So I was actually to be really specific, I was a pediatric cardiac anesthesiologist. So I was working like 80 plus hours a week, taking care of really, really sick, babies and children, having open heart surgeries and, other serious procedures and whatnot. And I just have the personality when in medicine where I'm 100% or nothing. I can't 90% or 80%. It does not, my brain cannot do it. I can't. So it's great if you're my patient, but it turned out to be terrible if you were me because like I was, so young at the time and I didn't really understand I didn't really understand I was taking in all of the stuff that was happening around me. But I started to get, some burnout. And the first symptoms that started to happen, I started not sleeping well. And I always slept super great, my entire life and all through training and everything, medical school and internship, residency, fellowship, all that stuff's, no problems. And then, so I started not sleeping well and then started getting other little symptoms like some stomach issues and some like heart palpitations and little things that now it's like, duh, of course, that's stress and burnout, like, hello. But, back then I didn't know. So I was always a very healthy person. But I wanted to know, like, why are these symptoms occurring? So I went to a quote, very good primary care doctor. And, they spent a good amount of time with me and everything. Again, very good traditional doctor, nothing bad to say. But, of course, the answer was, oh, you're not sleeping. Do you want this prescription to help you sleep? And, oh, your stomach is bothering you. Let me give you this acid blocker to shut down your stomach from making acid. And I left that appointment thinking that, like, at the time I was in my young 30s, I was like, well, I don't want to start taking these medications. Like, this makes no sense to me. I want to know why. And, so that kind of started my whole journey. And luckily for me, one of my colleagues I was working with at the time, she didn't tell me why she was going to acupuncture, but she told me she was going to acupuncture and that every time she goes, she gets amazing sleep. And at that point I was like, sign me up. I will do anything to get a good night's sleep. Like, this is terrible, And so I did. And I went and got acupuncture. And what do you know? Some acupuncture and Chinese herbs worked really great for my sleep. And then I was like, what can I do for these like little stomach symptoms I'm having? And then of course, it helped me out there. And so the very first thing I did was I was able to reduce my anesthesia working hours, and I actually got trained in medical acupuncture first because it was the first thing that was like, aha, okay, this is something else that can help besides medications.
Yeah.
Yeah. And so after that, it was funny enough, it was in acupuncture training that I met other doctors that were doing integrative medicine. And there was this one woman who said she was doing functional medicine. I was like, what is that? And she explained it to me and it sounded really cool. And I was like, let me look into the training pathways for it and everything. And then there I was, signed up to do the, functional medicine training through the Institute of Functional Medicine, which actually, by the way, they do international, they do international training. And so if you are a licensed practitioner of any kind, you can actually go through their entire certification training program. And it takes just under, I think, 2 years-ish, I want to say, if I remember correctly. It was a while ago now. And there's an exam, written exam and a case study exam. Like, it's an official, training to get certified in functional medicine. So I did acupuncture and functional medicine training, and then decided to kind of break out on my own and start my own practice. And that was in 2015. And here I am now, 2022.
Can you explain a little bit about your practice, where it is and who is there and what you do?
Yeah. So it's called Arizona Wellness Medicine. And I'm, of course, in Arizona, Scottsdale, Arizona, to be specific, but which is a suburb of Phoenix. And yeah, we really do functional medicine. There's 4 of us that are certified practitioners that do functional medicine, but I also have another physician who does medical acupuncture also. And I have a registered dietitian and a certified functional medicine health coach in the practice also. And so and all of those other practitioners there are there for, help and support, along the journey. Because as a doctor, I'm saying, hey, patient X, this is the nutrition plan I would like you to do. And I give all kinds of information and we talk about it, but that's one thing. Executing it is another, right? And so,
yeah.
this is why, we have, in my personal practice now, it's required. There's 2 health coaching sessions, like just automatically built into your new patient visit. Like it's happening, because we've really focused on nutrition and sleep, exercise and movement, stress management, toxin reduction. And so a lot of people, if you're going to try to change all of those things at one time, it can be overwhelming. And so we need a stepwise process in order to get people to start doing things that will change their health, but also not be overwhelmed by it.
Yeah, because it can be a little bit overwhelming. And you explained in the beginning what a functional, like when someone comes into your wellness center, the procedure of the time that you spend with them and the questions you ask. So if I was to come if I was living in Arizona and I came to a wellness center and had a session with you, is it just a lot of probing questions and just, really finding out how I am today, or is it a mixture of how I am sitting in front of you today and everything that's happened in the past, like you've said?
Yeah, we do review it. It's called a timeline in functional medicine. So what happened, over your whole life, we do review that. So, and how we do it in our practice is it's done by years and decades. And so I will actually have notes, like the important kind of highlights. And everyone fills out the forms differently. So some people write almost nothing. And I'm like, I know there's more to your story because of the symptom thing that you filled out. There's a lot going on. And then other people want to, give every little detail. So I will pluck out the important things and questions I want to ask. And I'll start through and I'll start telling, because part of functional medicine is retelling your story, because I want to make sure I have your story right. It's not enough for you to write it. I want to make sure I tell it back to you and you agree, or oh, you know what? I forgot this happened to me when I was, 16, or, that's not exactly what I meant, but it's this. I want to make sure we get it right, because that first visit, I really do get to know you, and that's going to lead me down to what areas of testing do I want to start with. And there's a saying we like to say, it's like peeling the layers of the onion away, right? It's like, this is not a quick fix medicine. This is, all the lifestyle factors take time to get down to doing what's going to work for you. And that's another thing, is it's very personalized. This is not cookie cutter at all. Obviously there's several things we should all be doing on a regular basis for our health, but there's not one exact diet that works for everyone. There's not one exact exercise plan that works for everyone. There's not one nutritional supplement plan that works for everyone. So we really have to, talk about your symptoms and look at your labs and see how things are going and adjust course as we go along.
Yeah, I've had a smile on my face the whole time we're talking. It's like, this is just, I love I love
awesome.
this stuff so much, and I want people to know about it, because while you were talking, I just wrote a couple of words down. I wrote 2 words. When someone comes to you or comes to a functional medicine doctor, I write down belief and I write down habits. So I find with my clients too, is when you're looking at changing a lifestyle or looking to improve your health and wellness, part of it is believing that it is actually that simple. A lot of people can't get their head around what you put into your body is actually your output, and there's no, you don't have to measure anything, but it's the dark leafy greens and the good quality food. I think Dr. Mark Hyman talks about the qualitarian diet, where everything is good quality food. And I think a part of it is having self-belief that this stuff actually works, but you can actually do it. Because I think a lot of people sabotage going, oh, it's too hard, or that's stupid, that's not going to work.
Right.
Yeah.
That's one of the main reasons why we incorporated health coaching, because it's for some people it's not enough. I still, have some patients who sit in front of me, and I know they could teach someone else exactly what to do with their diet and their exercise and their, sleep and, their stress and all that. They could teach someone else what to do, but they have a problem, maintaining it for themselves on a consistent basis. So that's where I find, things like health coaching. And then if someone really needs to get granular with, calories and macros and whatnot, then we have a registered dietitian, but that's not as I'm sure you've experienced too, it's not the majority of people, right? You just need to, teach people what to eat. What are the, eat real food basically, right?
Yeah. I find what blows a lot of my clients' minds is when we show them what to eat, but I give them the why. Like I actually give them you have this because, you know, it actually improves, like you talk about the gut health and the brain health, and then you talk about hormones. And like, I think, I'd love to hear your opinion on this too. I think there's a lot of people out there that don't know what it feels like to feel healthy. And
Yeah.
the symptoms, it's not normal to, and I'd love for you to give me some examples of what you see on a daily basis, but it's not normal not to go to the toilet every day, like have a good poo, you know, and it's the poo that's you're in and you're out and it feels great and off you go. Like it doesn't take up 3/4 of your morning.
Right.
You know, and also for women to know that when they get their period, it's like, oh, like, especially for me now when I've worked with my hormones, I just go, oh no, I've got it. Like I have no symptoms. I have no idea. I know when I'm getting it, but when I get it, it's still a nice little surprise. I'm like, oh, hello. Like it's no pain. I'd love people to know that, like bloating is not normal. And it's like the biofeedback. Like I love teaching people about, and then knowing that your body is always trying to tell you something. And do you find that when you were practicing like medicine with the kids and stuff, and what a beautiful job that you were doing, service that you're doing with the children. But it's interesting that even with your medical background and medical knowledge, you were like, oh, I'll just keep pushing forward. I'll just keep pushing forward, and because we don't know what we don't know.
Yeah, exactly. Well, and then, you know, it's interesting because I was still, you know, doing, pediatric anesthesiology while I was getting, you know, training in acupuncture and functional medicine. So I had this weird transition for a little while where I would start to see things. I'm like, why are we taking this 15-year-old's gallbladder out? Has anyone talked to her about her diet? Has anyone tested her for celiac disease? Like these things started happening. And then I started being like, oh my God, like I couldn't withhold the information from people.
Was it like a scenario there that actually happened with the gallbladder?
100%. Yeah, I can tell you everything about that day and the case and the surgeon and the whole 9 yards. But yeah, there were multiple things like that kind of showing up, over and over again. And, or because I did, for kids, usually get general anesthesia when they get endoscopies and colonoscopies. So like, oh my gosh, did I see like all these, GI complaints, and these, kids are getting procedures and scopes and all this stuff. And, again, it's not that they're, I want to be careful because it's not that my colleagues are bad doctors. It's just, I was trained the same way. It's all we know. It's how we're taught. So functional medicine looks at things, integrative medicine, naturopathic medicine. We look at things in a different way. We want to know, why is it happening? We want to try to fix it naturally because your body wants to be healthy. You just have to let it, you just have to, hold its hand, so to speak, and give it the right inputs, and it'll happen.
Yeah. Cause isn't our body always trying to find balance? Like it actually wants to be, is it homeostasis or is it like that balance? Right.
Yeah, exactly. Yeah, exactly. And so you want to give the body what creates health, and you want to remove what causes disease. It's almost that simple. And so, but the complexity is finding for each individual person what those things are, because I always say like all the lifestyle factors, so nutrition, sleep, exercise and movement, stress management, toxin reduction, that's about 80% of health. And if you work with someone on just those things, there's a high probability that your health and your life, both of those things, will improve dramatically. The other 20% is what's going on in your own body's biochemistry. So that's where all the advanced laboratory testing and whatnot comes in. So that's where it's like, okay, if someone is, let's say, in a mold exposed environment, you're only going to get so far with all the lifestyle changes. They're in a toxic environment. We have to do something about that. And then we have to detoxify, we have to get the mold out of their system, so to speak, and get their immune system working again the right way, and so on and so forth. So, and it's the same with hormone balance, right? It's like if the hormones are out of balance, all the lifestyle things are 100% going to support that. But depending on how severe things are, they need some nutritional supplements and herbs, and or sometimes some, prescriptions to get them through until things are better. Absolutely. So it's different for everyone. And that's why we do all this advanced testing in functional medicine too. We want to know what is your specific picture and what do we need to do for you specifically.
It's really interesting. And do you also let clients know, that patients know, that during this time of testing and prescribing them and helping them like change their lives, basically, that in 10 years time their body can change? Like that was such a interesting thing that I learned, that what I'm doing for my body now, or what foods may work for me, maybe in 10 or 15 years time, you know what I mean? Like I've noticed lately I've had a resistance to pumpkin. I can't eat pumpkin personally because I get a bit of swelling in the eyes, and it's a bit of a histamine food, right?
Oh, yeah. See, that's your body telling you, hey, maybe not a great idea right now for various reasons. Yeah.
And it's interesting because you, like you said, you can do all the eat well, move your body, like do all the markers that everyone knows. And then like I was doing everything, and I'm a big believer in my clients roll their eyes when I ask them to do this, but I get them to do a biofeedback journal, because how do you know what's working for you if you don't know what you're putting into it? Like you need to write it down, because it's going to give you information straight away. And for me, like luckily I had that, because I went, you know, I had swelling of the eyes. I took antihistamines and drops, and then I went to an eye specialist. It was fine. And then I went to this plastic surgeon that was like, oh, your eyes are swollen because your forehead's so stuck out. What we can do, actually, this, shave the bone here, so then you don't have the swelling of the eyes. And I was like no.
Wait, or don't eat pumpkin.
But I didn't know.
Right?
But that was me seeing the eye doctor and the eye specialist and the plastic surgeon and stuff was way before me going.
No, totally. Yeah.
Right. So I was like,
yeah.
I was sitting
what a great example though, right, Barbara? Of like, holy cow, someone was going to have you do like a surgical procedure and it turned out to be a food sensitivity. It's like, really?
That's what I mean. Yeah. Then a lot of people can be like, pumpkin's great for you and it's good for you and it's a great whole food. Absolutely. But right now in my body, it's not a Barbara food for now. So I know. And also almost the same with spinach. Like it's interesting that, yeah.
Ooh, okay. Yeah. You're triggering something. So maybe not even just histamines, but another thing to consider is oxalates. If you know anything about oxalates.
No, I don't.
So oxalates are in, you'll totally look it up. I actually I do have some good resources on my website about oxalates. So oxalates are in healthy foods. They're not bad for you, but spinach, berries, nuts, like there's a list of foods that are higher in oxalates. Now, for most people, like you wouldn't even think about this. This is not a problem at all. But for those that have like a genetic predisposition, and then we all know, like with epigenetics, there's, you know, the environment can pull the trigger on a loaded gun. The genetics are the loaded gun, right? And then just for whatever reason, you start to have some issues with, you know, processing the oxalates. And then what happens is they can build up and they can actually even crystallize a little bit. You can get GI symptoms. You can get joint pains. You can get urinary symptoms. There's like a bunch of stuff that can happen. But this is like one example of kind of like, is it what? So this is like this is part of the mystery. Like we're also detectives in functional medicine. So here you are saying like, oh, I've got a pumpkin and then I've got spinach, and I'm like, okay. Could they be random food quote allergies? They could be that, you know, and could they be food sensitivities? They could be, but then food intolerances are things like you already mentioned histamine. And then I'm talking about oxalates. There's salicylates. I mean, there's a whole group of other things that they're not really they're a true intolerance. So like lactose intolerance, everyone knows about lactose intolerance, right? Like your body cannot, like you're not making enough of the enzyme to break it down. It has nothing to do with an allergy or sensitivity. Like your immune system's not responding. Your body just cannot, you know, like really process it, right? But you can have intolerances, you know, to histamine. Foods that are high in histamines or foods that release histamines, and same with oxalates. Those are probably the two most common, I would say, after, of course, a lactose intolerance when it comes to, you know, food intolerances. But there's so many reasons why that something could be going on, and it may not be the same for everybody.
No, and the thing is, I was you know, fueling my body with really good food, and I have never had, touch wood, gut issues or anything like that. I've really tried to look after myself for the most part of my life. But that was a perfect example I use for my clients, that, hey, just because this food is nutritionally dense, it's a whole food, it's a superfood, it's amazing, it's farm to table, which we want most people to eat, or we want everyone to eat. Here I am, a perfect example of, okay, my body is telling me, Barbs, I don't need that food, I don't like that food, please listen to me. I'm just going to give you some bung eyes for a little bit so you can
Right.
you can stay away from that food. And I think it's really important that I share that with people too, because I'm like, just because you may see a social media influencer or whatever that's having these green smoothies, you're not them,
Oh,
right?
oh yeah. Oh my God. Yeah. Such a great example, by the way. Yeah. So one of my favorite questions is this food good or bad for me? It's like, okay, well, let's have a talk about that. Because the answer is like probably different for everyone, number one. And number two, mindset wise, even like you want to avoid like the good versus bad kind of, evil versus good thing in your mind. But yeah, it's just so individualized, and you just have to figure out what's good for you. But yeah, there's the latest, like with your green smoothie thing, you just reminded me of the whole celery juice thing. And celery is another one that's like super high in oxalates, and it's like, these people all of a sudden are like, why am I getting these joint pains? And they're all over the place. Or like, symptoms start happening from a quote healthy food. And again, it's not that celery is bad for everyone, right? It's not a good versus bad. It's like, how about, is it good or bad for you even at the time of life you're in right there? Yeah, I have a similar story of your pumpkin. It was eggs for me. I used to eat eggs every single day. And then, over time, I just became intolerant to them. I can only do them a couple times a week now. Great, healthy food. I would never say to anyone, don't eat eggs, right?
Yeah.
Like,
Yeah.
But it's our own body's like personal. It's like what's going on in your gut microbiome and your immune system, like all these other things all kind of, combined.
How cool is that we can actually share that with people that, and coming from the sport that I've came from, and my listeners will know, like bodybuilding background is, that was very, very heavily managed by calories and input and output, and this is good or this is bad. And I do find that a lot of clients too, as soon as you say something's bad or forbidden, food is emotional for a lot of people. If you say that it's bad, guess what they're going to do? They're going to self-sabotage, because they're not good. I've done all this dieting. I've tried everything. Even when patients are sitting in front of you, I bet you part of their mindset is like, this is not going to work. And they're already giving themselves an out to get takeaway on the way home, or to, like, you know what I mean? Like, not even give themselves the chance of, please, can you try this? It's really simple. I promise you it will change your life. It's not about, it's about, I really want to spread this message that it is that easy. It's not hard. And I love talking about going back to when we first came onto this earth. Like I say, and I'm not a trained doctor, and this is like just how I explain it, because I feel like it really resonated with me when I learned this stuff, that our body and our brain haven't changed like at all really since we've come onto this earth. So when you open that packet of chips, when it goes into your body's like, is this food? What do I do with this? I don't know. And that's the best way for me to explain that when I say to my clients, whatever you're going to put into your mouth, does caveman days, like if we're walking around then, does your body recognize that? Because it'll know what to do with it. Otherwise, your body inflames, because it's like it's trying to protect you and it's trying to help you.
Yep. Yeah, exactly. Nothing happens on accident, in our bodies. Like all the responses are, for a reason. Yeah.
Yeah. And one thing I do want to highlight too is stress. Like, do you find that everyone's living a lifestyle that we're not built for, but that we're not made for, and that we can do, again, we're talking about all the markers, sleep, gut health, your hormones in check, eating the right foods. And then what happens is, obviously stress can blanket everything in the body, and almost, am I right in saying that?
Oh, absolutely. And I, because, I do a lot of, obviously, extensive testing, and I spent a lot of time talking to people too. I've seen, because I have a fair amount of autoimmune disease patients in functional medicine, because that's one of, we offer one of the only kind of hopes, let's say, for possible reversal of autoimmune disease, or if not, worst case scenario is better control of your autoimmune disease. And I see it all the time, like so I'm measuring antibody levels, right? So for example, Hashimoto's thyroiditis is the most common cause of hypothyroidism, especially in women. And, so I'm measuring antibodies and, be talking to someone like, well, my diet hasn't changed. My, exercise is still good. I'm still sleeping, but they had this super traumatic thing happen. Boom. Like we'll see antibodies shoot through the roof. So you can eat. So stress gets you from so many different angles, right? So because in a nutshell, what you're doing is you're flipping on that sympathetic nervous system, which is that fight or flight, part of the autonomic nervous system. And then the parasympathetic is the rest, relax, digest side, healing side of the nervous system. So you want to do everything you can to foster being in parasympathetic more than sympathetic. Now, our acute stress responses serve us well in certain conditions, right? Like back in the Paleolithic days that you were talking about, you want to be able to flip that sucker on. You want blood flow to the muscles. You want to be able to run away from that thing chasing you, right? So it works really well. But what's happened in modern times is we're flipped on like that all the time, and we're got all kinds of toxin exposures that we didn't have before. We have artificial light and like all the technology and blue light. Like there's so many things that are stressors on the body, and they do all add up to one giant stress. So that's one thing I like to be clear on people. It's like if you're, poor nutrition is a stress, not getting enough good quality sleep is a stress, exercising too little or too much is a stress, right? The toxin exposures is a stress. Hormones being out of balance, chronic infections, nutrient deficiencies, all these things are all stresses on the body that all add up. So, because when you say stress, most people think about the mental, emotional stresses, and they contribute so hugely. So it's not to minimize that at all, but I think people forget about all the other stresses that get added up, and just contribute to the whole picture of how is your nervous system functioning in your body. And because it's all about that balance.
Yeah. Thank you for explaining it that way, because I don't think many people would have heard stress. Such a beautiful way of explaining that it's just not the physical and the emotional, it's all the other factors that you do in your, that are in your life. So with all of that, we if someone's listening to this going, I'm too old, or I can't be bothered, or gosh, this sounds so overwhelming, where would be a good place for someone to just start?
Yeah. So, we literally have patients all from babies all the way on up to my oldest patient is 90. And by the way, like I love my older patients. They're so cute. I have a good handful in their late 80s and 90s. It's like they're sitting in front of me and I'm like, my goodness, I hope I am just as spry and my brain is working just as well as yours is right now, because it's amazing. But yeah, so I don't accept, I'm too old, or, there really aren't. I have patients from all walks of life, all different cultural backgrounds, all different socioeconomic backgrounds. You can always do something. And so when we're working with people, even if you never do functional medicine, the best thing you can do for yourself is start to make some of these lifestyle changes, right? So start, eating real food that's very well sourced, start prioritizing your sleep. I think it's another thing, like people like don't fully understand the effect of not getting enough good quality sleep. It's huge. Like it makes such a big difference in your health. I see it in blood work, you see it in symptoms, you see it and it has a waterfall effect on so many other areas of your life, right? So prioritizing that, making sure you're getting some movement in, reducing toxins when you can. So lifestyle factors are like, that's the place to start. And if all of that sounds like, oh my gosh, I need to change everything she just said. Like the thing that my top recommendation would be, pick the thing that sounds the easiest for you. If you're like, you know what, I can download a meditation app. I can find 10 minutes to do that. Cool. That's where you start. Once you've got that down consistently, then, by the way, once the habits start to change, you'll find you'll want to do the other things more, right? So like then maybe you're like, okay, maybe I can do a couple of nutrition changes. And so you don't always have to do something really extreme. You don't always have to do a detox or a reset. They're really useful tools, which we'll talk about, but there are some people that are like, nope, it's too much for me to eliminate all those things at one time. Okay, cool. So instead of eliminating them all at one time, let's start with one thing and like, just check that out. See what difference that makes or doesn't make in your health. And then keep that one thing eliminated and go to do a second elimination. Like you don't have to do everything, all at one time, and you want to do it at your own pace too.
Yeah. So we might as well talk about that now. When you talk about elimination and detox and stuff. So I think we're going to be talking about how we feed ourselves, how we nourish ourselves, and nutrition. And I think when people look at functional medicine and stuff, how do people, when we talk about detox or elimination, how does that kind of look to someone that wants to improve how they eat?
Yeah. So, I really like to use a paleo template to get people kind of their diet cleaned up and to do almost like a food elimination process. Because I think a lot of people don't really know how, like to one of your comments earlier, you don't really know how, like, what is healthy feel like for you? Like, what is, because you're so used to your norm. And a lot of the things you were saying before, like, it's normal to, not go to the bathroom every day or normal to be bloated. It's not normal. It's common. It's not normal. It's common. Like, you have to remember that, right? Like, just because you talk to, 5 of your friends and they have similar issues, that's common. It's not normal. Right? Like, it's not supposed to be, happening. So, I do really like to walk people through, a good, 30-day reset, paleo reset, but in front of that, and actually have a master class where it's called the 7 Weeks to Your Healthiest Self Master Class, where we do it. I kind of do this 3-week jumpstart in front of the 30-day elimination. So it's kind of what I said, which is like a stepwise process of, getting your other lifestyle factors on point, making some dietary changes. And some patients, the 3 weeks turns into 6 weeks or 3 months, like whatever. It doesn't have to be done super quick. And then getting ready to do a 30-day, I like to use a paleo reset quite often because it gets you eating real food, right? Like, it takes away processed packaged items. It takes away the high sugar items. It takes away the alcohol, and then it obviously eliminates a lot of really common food allergies and food sensitivities, right? Like, it takes away gluten because there's no grains in paleo. And it's not to say, again, are grains evil and bad? No, but a lot of the usual grains that people are eating, like, breads and, cookies and crackers and all those things, they're just really highly processed. They're not in their natural state. And then, then there's the, gluten factor on top of that, right? Like, it's just a really common food sensitivity, and gluten is a very hard protein for the GI tract to digest, and it contributes to, inflammation and intestinal permeability or leaky gut. So there's a reason behind each of the things that we are kind of taking out of the diet, and we paleo kind of gets rid of a lot of the common ones, right? So it takes out, naturally gluten because it takes out grains, it takes out dairy, right? It takes out soy, it takes out the legume family, and so it
takes out sugar as well.
Oh yeah. There's sugars and alcohol processed, all the processed food items, all those go. So, it takes out the most common ones, and so your chance of creating health, goes up, and reducing symptoms goes up. Now, remember, I also said there's not one perfect diet for everyone. So, it's not like I'm putting 100% of patients on a regular paleo reset. Sometimes I use an autoimmune protocol. And sometimes we're just doing a simple gluten dairy elimination. Sometimes we'll pick, other, food plans, just depending on, again, history and symptoms and what the labs are telling us. But in general, going through this like 30-day elimination with a proper food reintroduction. So most people feel really good, at the end of their 30-day reset, but they have a couple things they're kind of jonesing for, right? They're like, ooh, I really miss my oatmeal in the morning, or I really they miss something that's maybe not an unhealthy food, but wasn't necessarily on the paleo reset. So in the oatmeal example, we're going to make sure they're not getting like the instant oatmeal that has like 35 grams of sugar in it, right? Like, we're going to have them make some overnight oats from some organic steel cut oats and so on and so forth, right? So we're changing what that is, but they really still want to have it. That's totally cool. You add that one food back in. So I tell people to do one new food, and you do it, at least 2, if not 3 times a day for 3 days in a row. So you really want to show your body like a lot of it, because if you just have like a couple bites of oatmeal and you're like, oh, I feel fine, I can eat that. Like, that's not enough, because you may find a a certain dose, let's say, to where, oh, I ate it 3 days in a row a lot, and yep, it definitely causes gas and bloating, or I get joint pain, or, I noticed I get some headaches, or my depression is worse, or whatever symptom happens. And it may not be the gut, right? Because if it's the gut, we're all like, oh, duh, don't eat that.
Yeah.
But it could be something outside of the gut, like your pumpkin example, right? Like with the eye thing, like that's a perfect example of something that you would, you'd have a hard time linking to your food. But when you do these reintros, I have like a food reintroduction tracker where it kind of reminds you to do a head to toe check on symptoms each day that you're reintroducing, because it might not happen on day 1, it might not happen on day 2, but it could happen on day 3, right? And so if you find that food gives you a symptom, you say, okay, you know what? It's probably not a great idea for me to have that food on a regular basis. Does it mean you never ever have that food? No. I mean, if you really like it, you may choose to eat it at some point, but you know what the price tag will be if you you do. You may be like, oh, I'm going to eat this oatmeal because I really want it, but I know I'm going to get bloating, or I know I'm going to get joint pain, or whatever the case may be. And you just know you don't do it on a regular basis. But because we want, while we want people eating, a good, healthy, real food diet, I also don't want people to be too restricted for too long. I think that's also a problem on the other end, because I have people that are like, but I can't eat that because it's not XYZ. And it's like, okay, I appreciate that. However, we also want to be sure you're not being, super restrictive. I actually tell people I want them on the biggest amount of foods that work for them. That's the real answer.
Right. Yeah. Okay. Because you can go the other way too, where you're restricted for so long that when you do introduce something, your body will flare up. Like, do you know what I mean? Like your body gets used to what it's eating as well.
Yes. Yeah, exactly. Yeah. So it is. So, and the food reintroductions at the end, by the way, because a lot of people are like, oh my gosh, it'll take me forever to get all the foods back in. I don't want to do it. It's like, no. You only need to reintroduce the ones that you want to have on a regular basis. If you're like, I don't care about corn, like I only have it when I go out to eat Mexican food, so less than once a week or a couple times a month or something, great. You don't have to do a corn reintro then. Your body's only going to see it, once or twice a month. Like why bother? If you want to get it back in the diet on a regular basis, then I think it's really important to do a proper food reintroduction.
Yeah, I love how realistic you are, because a lot of people do freak out. A lot of people freak out that, oh, I have to cut this out forever, and I don't know. I just can't live like that. So they just almost just shut it off before they've even started. Like I said, that belief is like, oh no, that's too hard, I have to cut it out. That's not realistic.
Yeah, like how many times, and I hear it all the time too, like how many times do you hear people saying like, I can't avoid gluten, it's everywhere. And then there's people like you and I, they're like, I've been doing it for years. Like it's actually pretty easy. Like once you get to know, it's one of those things, once you get to know what your resources are and what things to look for, what you can and can't do, and so on and so forth, it does become easier, but you do just have to give it a try. But it is, this is where the health coaching part comes in. This is where I think it's, good to have a coach, someone guiding you with what to do and tips and tricks and resources for things. They're like, I'm used to having a tortilla wrap for lunch. Like, what do I do? Well, someone like you or I, we could probably spit out like a half a dozen other options, that would work for getting that done, And so it's just a learning process.
And your taste buds adjust too. That's what I always share with people, that the qualitarian diet, but the overcrowding. So start just adding a lot of more good food, and then over time your body will start craving it. But we don't eat real food, so your body's always hungry because you're not eating real food. But as soon as you eat real food, you won't eat a whole plate of something, but also your taste buds will actually change over time to really enjoy the food.
Yeah, it's so great. Like if I think back to the stuff we were raised on as kids, it's like the soda and the candy and like all that stuff. And of course, years later, you go to try some of these things because it's nostalgic, right? You're like, oh, when I was a kid, I used to like this, whatever Halloween candy it was. It's disgusting. Like, I'm like, I can't even believe I, even liked that. It's so gross. Cause like you say, your taste buds change more towards, the natural stuff. But it's a good thing, right? It's a good thing that happens over time. And it does take time for that to occur. That's the
It
other
takes
thing.
a long time. And I think even
Yeah.
with the gluten thing is such an awesome example because I find that a lot of people will directly go to gluten-free products. And so what they'll do is they'll get the
Oh,
gluten-free bread,
oh,
get
sure.
cookies, and then I'll say
Yes.
to them,
Yeah.
can you read the ingredients for me? Do you know what they are? And they're like, no. And I'm like, do you know what? Maybe stick with the gluten, because sometimes the gluten, dare I say it, is better than the gluten-free products, because the gluten-free products are full of so much crap.
Yep. Yes. Oh, I love that you said that. That's like such an important concept, because I have to remind people, because the mindset starts to think like, ooh, it's gluten free, it's healthy. It's like, hold on, a cookie is still a cookie, a brownie is still a brownie. Like, you're still, you're eating maybe a healthier version for yourself. If you happen to be really gluten sensitive or be celiac, for example, yes, those products are a better choice, let's say, but it's not a healthy choice, right? That's what we have to kind of redirect the mindset towards.
Yeah. And on the odd occasion, if I'm going out with some girlfriends, I'll actually just order off the menu. And they're like, oh, are you supposed to eat that? Are you allowed to eat that? And I'm like, oh, wow, there's gluten. I know there's dairy. I know there's gluten. I know there's, and you know what? I'm going to enjoy it. But it's interesting that people love to, when you do this for a job, that, and it's your career.
Oh, yeah.
People, if I'm eating a chocolate bar, people, oh, you shouldn't be eating that. And it's like,
I know. Or even the people we're out with will order, some stuff or whatever, and they'll be like, like don't judge me, that kind of thing. It's like, I'm just out to eat with you. You're your own person. Like, I'll eat what I want to eat. You eat what you want to eat. We're adults. It's all good. And that's, that kind of brings us to that another important concept. Like, you don't, if you're not doing a strict 30-day elimination, for example, you don't have to be 100% perfect 100% of the time. You'll drive yourself crazy. And that leads to, I think it leads to just bad behaviors, right? It leads to kind of, binging, kind of habits where you're like, you're going to avoid for so long. And then you're going to be like, I haven't had anything I really want to eat. So now I'm going to go and, really have at it with a bunch of ice cream or whatever it may be.
I've been there, I've done that. And I think too, I also say to people, when you're having that bad thing, can you just stop? Because you inhale it. Like, it's the packet of chips, it's the ice cream, and people always eat it when they're watching TV or they're reading a book or they're scrolling on social media. Like, if you're going to have the tub of ice cream, or you're going to have, and people look at me and go, I can't believe you just said that, Barbs. And I was like, eat it, but be with it. Like, eat it, look at it, smell it, eat it, enjoy it. The novelty will wear off. It actually won't be fun. And I'm like, do you actually enjoy it? And they're like, oh no. Like, it's filling a void, and it's an emotional void. It's not a nutritional void.
Exactly. Yeah, you're treating something.
Yeah, exactly.
Yep.
And just one of the other things before we move on to wrapping up today is with gluten, I do find that when I explain to my clients what it does to the body, they freak out. And when I talk to them about glyphosate,
oh my goodness, that's another one, right? Just
that was a huge thing. Like, I just share with them what spun my wheels and like blew my brain, literally going, how do people not know about this? How do we not talk about it? And that, like, before the 1980s, it actually was okay. So when you have your grandparents, your great grandparents going, silly with this gluten nonsense, and the dairy nonsense, it's all silly. It's like, but in your day it was okay. Like, it was like, you look at human frames and stuff. There were no obese people. There were no diabetes or anything. Like, in the 60s and the 70s, they were all lean and yeah, sure, they didn't live as long. But what I find when I say to people too is, do you want a life that as human beings can live a really long time now, but having a long life, filling yourself with pills just to get by every day? Or do you want a longer life with no medications and your body is actually made to do what it can do? Like, what kind of, there's
quality,
a long life, but do you want a happy life as well?
Yeah, quality and happiness, absolutely.
Yeah. So that's what I find too, is when people know the why, and that's where functional medicine is so amazing. And I'm all about giving people the choice, and I'm all about, I see a lot of the time that clients will come and see me for particular things, and they've gone to see so many health practitioners beforehand, chiros or osteos or like whoever, but that patient or that client hasn't been seen, hasn't been heard, hasn't been believed, has been shut down, or they know their own body, but no, you're being silly, or there's nothing wrong with you. And I've got someone sitting in front of me going, no, there is something wrong with me. And I want people with functional medicine as a tool to make your life better and to help you. Yeah. That's what I want more people to know about it. So, I'm just really grateful that you've been able to come on today and taken the time from your busy practice to,
oh, you're so welcome. My pleasure.
To help people know that there's choices, that just because, and I have respect for the medical profession, because it's I was a premature baby. So for my story, the medical world saved my life.
Yes. And we need traditional medicine, right? Like, it is life-saving, and it's not to say for, throw it out, but it is to say for chronic health conditions, we can do a lot better.
Yeah. And that's what I mean. As soon as we start talking down this way, people go, oh, so I shouldn't be taking the pills. I shouldn't see a GP. There's nothing wrong with them. But being your own health advocate, if something doesn't feel right, but even knowing that when you go to the practitioner and they give you a tablet, why are you taking the tablet? But what's the cause? And if people know, if they know it's a Band-Aid approach, I'm sure more people will be like knocking on your door, knocking on my door, going, can I learn some more about my body? How can I help myself?
Yeah, exactly. Well said.
Yeah, just awareness. So I think if people want to reach out to you and know more about you, or to look at this, the course, the masterclass that you do, can you share a little bit about that with us?
Yeah. So the best place to find me is my website. So dremilyparke.com. So DREMILYPARKE.com. And I provide tons of free content. I'm constantly doing videos and written blogs and recipes. I also have an online store, and I have that 7 Weeks to Your Healthiest Self masterclass that we were talking about. And for your podcast listeners, I do have a specific coupon code for you guys. It's SC for self-care, SC20, for 20% off if you want to give that a try. And I also do, have a medical practice in Arizona. Obviously, I know people from Australia are not going to come over to be a patient of mine. But I do provide lots of interesting content. I try to kind of keep it fresh. That's another thing about functional medicine, where all our noses are always to the ground. We're always looking at current research. There's always something new coming about. Hopefully the information will be helpful, and maybe even if I can get more people to start thinking about their own health or their own symptoms, if there's some little tidbit of education out there that will change someone's mind or make them think about their health and body differently, then that's a great reward.
Yeah. And I think that's beautiful, because you remember our bodies are constantly changing. So just because it's working for us today doesn't mean it's going to work for us tomorrow. But I really enjoyed this chat. Thank you so much for joining me on my podcast today.
Oh, you're so welcome, Barbara. Thank you so much for having me on.
Thank you so much for listening. I hope you enjoyed today's episode and it has inspired you on your self-care journey. Please feel free to share this with a friend and subscribe over on Apple Podcast. I really love hearing your feedback. So guys, please feel free to write a review on Apple and let me know which part of this episode resonated with you the most. To fall in love with yourself is the first secret to happiness. To find out a bit more about Self-Care Studio or the Studio Chat podcast, head over to my Instagram page, self_care_studio, or on my website, selfcarebybarbarathomson.com.au. Really look forward to seeing you on the next episode. Look after you, and I'll catch you soon. Bye!